Hi, everyone. Today, we are having our fourth and final Facebook Live chat, which have been presented by Home Instead Senior Care. As I hope some of you have had an opportunity to join in, I've talked with some amazing people this month in honor of National Alzheimer's Awareness Month and National Family Caregivers Month. And today, of course, is no exception. I'm so lucky to be joined by George Vradenburg, who is one of the driving forces behind Us Against Alzheimer's, which is a national nonprofit committed to stopping Alzheimer's by 2025. As if you've joined in before,
2020.
I'm sorry, 2020. I like that way more. And so anyway, so if anyone has any questions along the way, you can type them in as you've perhaps done, and we will try to get to them. But let's dive right in. Hi, George.
Hi, Lauren. Thank you for having me.
Thank you for being here. So, okay, you've set this huge goal of stopping Alzheimer's by 2020. Tell us, I guess first, tell me why you got involved with this work. Why Alzheimer's?
Well, my late wife, unfortunately died of a heart attack last year, but my late wife's mother and grandmother had been hit by this disease. Her own mother had been diagnosed with the disease in 1985. So by 2010, nothing seemed to be happening. Nothing. There's no movement, no energy, no spirit, no strategy for how to get at this disease. And so while we'd been raising money for the association for many years, she and I felt very much energized by the fact of trying to get in, just make noise, trying to disrupt things, trying to change the mythology that you can't get more money out of NIH for Alzheimer's, that you can't really collaborate in the field, that you can't really accelerate things because you're basically chained to the pace of science. And so each of those myths we've sort of broken down and really trying to challenge the prevailing myths of 2010. Because fearful that in the next 25 years, nothing else had happened. It's coming from my wife, then 25 years after that, coming from my daughter. So we very much wanted to get at this for our family. And we found two other people that were joined with us to found it. A guy named John Dwyer, a serial entrepreneur. So I'm not a scientist. I'm a lawyer and businessman by background. He is a serial entrepreneur. He has now eight of his aunts and 11 aunts and uncles who have had Alzheimer's, and both his grandparents have died of Alzheimer's. So he knows he's in the crosshairs. And Meryl Comer, who who was a very prominent caregiver because she's been taking care of her husband at home for 22 years with this disease. And the reason that he has not passed away is because he has no hospital-acquired infections. He has no bed sores. So his care is too good. And the great irony of a great professional journalist like Meryl, basically ending her career to take care of her husband, and then finding that by taking care of her husband, she's basically, I'm not going to say wasted her life, but she's basically seriously impacted what her life course has been.
Yeah. Wow. Wow.
And Jill Lesser, who was a founding board member of the organization, a young woman whose mother has Alzheimer's, and she has 3 rambunctious teenage kids, boys. And so we represent the full panoply of people who've been affected by this disease, or either directly or by caregiving.
Yeah, that's amazing. So that's sort of what brought you to it. Tell us, so you have this goal. Tell us about your work. What kind of progress has been made since you sort of, decided to make this such a priority? Where, what's the progress since you started?
Well, there's been, I think, a number of steps which can count as significant progress. The United States government committed itself to trying to find a means of prevention and effective treatment by 2025. We urged upon them getting a time-based goal very much in the spirit of John F. Kennedy's moonshot. If you set a goal and set a time limit and you're committed to it, you will begin to build the resources and the engagement of technologies that you need to do to hit the goal rather than just practices business as usual. And so that's what was our first step. And now every year NIH tells Congress what it needs in the way of appropriations for the following year, which will enable it to stay on course to get to the 2025 goal. And so we've had rather significant increases from $440 million a year when we started to now $2.3 billion a year. and that I don't think we've stopped. So I think that will continue to ramp up. That means more basic science. That means now investment in some of the infrastructure that we need. So that's a major step of progress.
Yeah.
Interestingly, I would characterize all the negative drug results as progress, because we now have learned a good deal of things, the most important of which is this disease starts 20 years before the symptoms appear. That means we may be able to find a drug to administer to people before symptoms appear and delay symptoms forever. So you may be amyloid positive or tau positive, but you never get symptomatic Alzheimer's. That would be great. And we now learned an awful lot about the ability to deal with this disease in non-pharmacological ways, non-drug ways, lifestyle changes, risk reduction techniques on comorbidities, and even new medicinal approaches, physician approaches to how to defer or mitigate dementia without ever getting a drug. So those things have happened. The World Health Organization has stepped up and now created a massive global effort. So a lot of things have happened that have been very positive. Do I think we're going to hit 2025? I think it's going to be a challenge, because I do think that not enough response at the national level from other governments and not enough response at the global level has meant that we're at risk of not hitting the 2025 goal.
Yeah. I guess I have a few questions off of what you said. First, I'll stick with sort of right where you just left off, which is, I guess, why is it so important for everyone in the world, for all the countries, to be on board? And how can we help change that? You know, I feel like we in America, and that's sort of my perspective, obviously, I feel, and I always say I'm so on the inside of it that it's easy for me to feel this way, but I feel in the last 5-6 years, there really has been a huge shift in people sharing their stories. And that in turn has influenced our government, as you said, to increase the funding drastically from 400 million to 2 billion, which is huge. And so what is being done to change the fact that there are other countries, like you mentioned before we got online here, you're traveling in December to this convention. Maybe you can tell us a little bit about that.
Sure. Well, I do think that we need to stimulate other national governments to adopt national plans. Of the 190 some countries that make up the WHO, there are only about a dozen or 2 dozen that actually have national dementia plans. So the World Health Organization has set a goal of getting every country to sign up with a national dementia plan in the next 5 years. And those plans are going to require reporting on the prevalence of the disease, the cost of the disease, improved methods of detection and diagnosis of the disease in every country of the world. And by doing that, I think we're going to expose the fact that this is not only a problem of a lot of people dying of the disease, which is horrible, but also a problem of economic development, social justice, economic justice, because poor people are going to get poorer, and rich people are going to have access to treatments. And those without resources, whether they be in communities in this country or around the world, won't. Because this impacts indigenous populations or minority populations more than it gets to the predominant populations of countries. And because it attacks women more than men, we're going to see major social justice issues in terms of getting access of those populations to treatments. And because there are sex-based differences in the way this disease works in human, we're not sure at all that the drugs that we put through the system are going to work for women as well as for men. So we're going to expose a lot of additional things. What you just talked about, the fact that people are talking about it, is beginning to reduce stigma and the isolation associated with it. But families who deal with this are isolated. And they're lonely. And so we haven't found a way really to connect and create a community around this yet. Just one statistic that really blows my mind away. We talk about a meeting in December to reactivate the global effort. Since the December 2013 meeting of the G8 health ministers, where we set the goal of 2025 to find a means of prevention and treatment, by my estimate, 25 million people have died as a result of causes related to this disease. 25 million people have died in 5 years. And, you know, you think of Ebola, we lost 1,000 people, scared the heck out of the world. 25 million is a big number. That's a lot of people. And those are not just individuals, those are 25 million families whose lives have been disrupted, whose careers have been disrupted, whose opportunities in life have been disrupted, and whose finances have been reduced by this disease. And so this is an epidemic at the size of nothing we've seen in our lives. It is bigger than HIV/AIDS. Not as scary because it's not infectious, but scary because of the size, scope, and prevalence of the disease globally.
Yeah. I mean, I know my own answer about it, but why do you think any country would have a hesitation to have a plan in place for dementia? Is it just that it's not talked about there? Is that the stigma is still so real? People are still so afraid that it hasn't reached a point where they understand these things? Is that because
I think there's still a lot of feeling around the world, and still some in the United States, that this is just a natural course of aging, that this is just what happens to a person when they get in their 70s and 80s. They lose their mind, and that's just a normal course of aging. And in some parts of the world, when we had our World Health Organization meeting back in 2015, we had countries who came and said that in their country, when somebody showed signs of dementia, they thought that they had been occupied by the devil. And basically they sent the witch doctors out. And when the exorcism didn't work, they chained people to trees and basically gave them food and water because they basically thought they were crazy. And so it's either crazy or a natural course of aging, but it's not a disease against which you can attack like other diseases. That was the prevailing thinking in many parts of the world.
Yeah.
Now, interestingly, China, which is a country of size and obviously with a massive aging population, now is about to approve the first Alzheimer's drug in 15 years. And so we're seeing efforts in some countries to invest in this disease, not at the scope and scale the United States is, but on the other hand, investing in it. And so Europe is investing to some extent. The UK is investing a lot. But China, interestingly, is going to have a drug for use in China by February of next year.
It's interesting. I'm just saying this, but I wonder if it has something to do with how a difference in the ways we respect our aging populations.
Or we have different standards.
Yeah, exactly.
Or clinical trials aren't run as smoothly or as well. You just sign 2,000 people up because you just assign them to a clinical trial. We don't know enough about the drug that's being approved in China, and it will go through testing in the United States and Europe, starting next.
Wow. Oh, so many things. Okay, let me get back on track here. So I joined the Us Against Alzheimer's Brain Trust and was happy to attend the amazing launch that we had with Laura Bush for the Campaign for Women's Brain Health. Last week I talked to Maria Shriver a bit about brain health and prevention. We just touched on it a little bit. But I guess maybe you could tell us a bit more about your campaign and, maybe some of the things that you do for brain health or your children do. Shed some light on your thoughts on brain health.
Well, my own view is that everyone ought to get a checkup from the neck up and make it as routine in their life as a checkup from the neck down, which we do every year, or we try to do every year. And I believe that people are not doing that for several reasons. One, I think we as a people tend to be afraid of asking about brain health, fearful that the answer is going to be a terminal disease we can't do anything about, so why ask, right? The healthcare providers, the doctors, they're a little afraid of having people ask them about brain health because they're not sure what they would say once they diagnosed Alzheimer's. But it turns out that there are a lot of things we can do today that can improve our brain health over the course of our lives. And to get people to actually ask about their brain health, to get doctors to actually be able to respond about brain health with steps you can take today, will have a couple of effects. We can treat non-Alzheimer's related causes of cognitive decline by traditional medicinal techniques, whether it's vitamin deficiency, whether it's sleep disorders, whether it's stress management or other things. There are things we can do to deal with cognitive decline, a foggy brain. I'm not as sharp this year as I was last. We have a lot of things we can do on that score. And also through lifestyle changes and management of related conditions like diabetes and heart, there are ways that we can reduce the progress or the progression of this disease, because hypertension is a major cause of problems with your brain. Diabetes is a major problem with the energy levels in your brain. So if you know that you're suffering some cognitive impairment, you will pay much more attention to those other potential aggravating causes. So there are risk reduction, lifestyle changes, and non-related to Alzheimer's. Even with respect to Alzheimer's, if you catch this early enough, we're going to get you into a clinical trial. First person cured of Alzheimer's is going to be in a clinical trial. So get into a clinical trial, help us find a means of preventing this disease through drugs.
Yeah.
So I just think brain health is a why do we treat the brain so differently than we do our heart? We got to check up on our heart. We got to check up on our blood pressure. Where's our brain vital? Where's our brain thermometer? Where's our, what are the things that we should be doing for our brain that we never have thought about doing because for some reason this is a very complex instrument and neither we nor doctors know yet how to deal with it.
Yeah, no, we need more doctors who are properly trained in treating Alzheimer's dementia patients. We at Hilarity for Charity actually have just started working with Richard Isaacson and creating videos for medical students to teach them about, coming into this field and sort of a big dive into properly diagnosing or like you said, even giving a proper neurological checkup, which is something that, there is no standard at this point for doctors. So that is something that, you have to.
I'm going to come back to you and see if we can't work together on that one.
Okay.
Richard Isaac, my wife was a client of Richard Isaacson's before she died. So I have a high regard for him.
Oh no, I'm his patient as well, and he's fantastic because this is the thing. This is at this point there are things that we can do, and what we can do is get checkups, know our numbers, as Dr. Isaacson says, know your genetics, get genetic testing, see where you fall. There are so many genes that are indicators for not just for dementia, but for anything. So getting on top of our personal health is really important, especially in a disease like this. So it's really important. Okay, so we've had a question from, I don't know if I'm pronouncing this correctly, Yoni has asked, has Japan been involved with Alzheimer's research and trials, being that Japan is the oldest population in the world? Well, that's interesting. Do you know much about?
Yes, we have a major partner. We have a Researchers Against Alzheimer's, which is now active in 18 of the G20 countries. So yes, Japan is a major hub of our efforts. And the answer is that they are paying a lot more attention to it. When we set our goal of a 2025 goal of finding a means of prevention and treatment, they set a 2025 goal of integrating their social support system and their medical system. So they basically wanted to integrate all of the care side of this equation to fit the 21st century disease model, which is chronic disease that are managed rather than acute diseases which are cured. So they basically are transforming their entire care system and their medical system to be integrated so that you go to a care center. It may see a doctor, you may see a psychiatrist, you may see a social worker, but you will see a team that is thinking about you, not just from the medical point of view, but also from the care point of view. So that was their goal. In the last year, they have actually set up the equivalent of an NIH. And yes, they are beginning to do clinical trials there. They are one of the starters of the dementia-friendly movement, which basically was an effort to get everyone in society committed to understanding what it was that was dementia, not a natural course of aging, but in fact, a prevalent condition in Japan. And so when you saw somebody confused about a stoplight, you offered help. So that you basically, how do you recognize a person with dementia and how do you help them? So they responded with structural changes in their social and medical systems and also a societal change in terms of respecting people with Alzheimer's or dementia and enabling people just in the normal course of their affairs to be supportive of them, to recognize it and to honor those people. That is the question about whether or not, honoring the elderly, that is part of that culture. And that's how they've responded.
Wow. I think we could do something like that here. I don't know.
We have a Dementia-Friendly America effort, which launched a few years ago. I was one of the co-launchers, I guess. But it's now in virtually 50 states have some Dementia-Friendly America effort in a community or in a county or indeed a statewide. We have a Dementia Friends movement, which is basically videos which you watch. You basically see how dementia people see the world. They see a black tile or a black rug in the room and they think it's a hole. And so they're fearful of walking across, tiled floors or a floor that has black spots on it because they see them as holes. And so you have to help them through that. They don't recognize that when they see in a mirror, they see themselves. They don't recognize it's themselves, so they get scared. So how is it that we recognize some of these symptoms of dementia, and how do we respond appropriately and respectfully and to those that have the disease? And so we're doing that in the United States now.
That's amazing. Okay, so I want to start wrapping up here and sort of go back to what you said about the increased funding for the NIH.
Yes.
So that is a good thing, because when the NIH is funding $2 billion into Alzheimer's research, that means there are more clinical trials, there's more work being done. What can we do? Basically, we talked about brain health, what we can do for ourselves. What can anyone watching this video do to help move the movement forward as far as getting more countries, getting more money from governments, et cetera, et cetera?
Well, I'd say three things. I would say first, sign up with the association, with Us Against Alzheimer's, with your organization, and just start expressing yourself. Because to the extent that we can add the number of voices, government policy will change not just on the funding level, but at CMS and at the FDA and all the agencies as well. So we basically continue to need that political support that will help move this along. Second, sign up for a clinical trial. Find out if there's a clinical trial in your area of the country. Antidote.com is a place to go that has an easy to use sort of series of questions and answers about where do you live, how old are you appropriate for a trial in your area. That is a way to actually contribute to finding a cure. So that is an amazing way. And others support financially. If you don't have the time to do any of these things, support financially, support Hilarity for Charity, support Us Against Alzheimer's. But there are Alzheimer's organizations across the country that are now basically committed to do this. And with our leaders engaged in an Alzheimer's disease coalition, over 100 Alzheimer's serving organizations are together in a common coalition. So supporting even a local Alzheimer's effort turns out to enable this combined set of voices to have a major impact on national policy and on industry practice.
Amazing. Well, thank you so much. I've so enjoyed getting to know you over the past few years and feel very honored to be in this fight with you. And I'm just so appreciative of all that you and Trish and everyone at Us Against Alzheimer's have done. And you guys are real trailblazers. So it's a real honor to know you and work among you. So
well, right back at you, Lauren, because basically the folks that are going to change this are families that have been affected by the disease, and having all of us patient-led organizations like yours and like mine be empowered is going to enable the patient's voice and power to come through. So thank you for what you do, and thank you for your support, and we will continue our support of you.
Thank you. So everyone listening at home, on behalf of everyone at HFC, thank you so much for watching these chats and for chiming in with questions. I hope that they've been helpful. They've been really helpful for me, I have to say. I feel like I've learned a lot. We still have a few days left to honor National Alzheimer's Awareness Month. So please be sure to add your Alzheimer's story using the hashtag Many Faces of Alzheimer's. You can do it on social media. You can send it to us at Hilarity for Charity. And remember, there's still time to donate to Hilarity for Charity and Us Against Alzheimer's. When you donate to us, caregivers will get the much needed help and relief that they need. You can learn more about it on our website or on our social media. Every donation, of course, goes a long way. $25 equals an hour of care. So we hope that you continue to join us and share your stories and help us fight the stigma, because that is the thing that is going to end this disease. So thank you again to George. Thank you to all of you who have been watching, and stay in touch, and hopefully we'll see you soon.
Good. Bye-bye.
All right.